Hello everyone, my name is Nicole Getz and I am a BSN student at Indiana State University, and today we will be discussing telemedicine. Telemedicine is the use of electronic information and telecommunication technologies. All that you need is a cellular device, an iPad or a computer, a device that can connect to the internet. Telemedicine has become more popular since COVID-19. It helps the public to practice social distancing, which in turn helps to protect you and your healthcare provider from COVID-19. You will also not have contact with other patients, which will also help keep you and your family safe. Telemedicine is not appropriate for everyone. You should talk to your doctor to see if telemedicine is appropriate for your needs. Some types of care that telemedicine provide are COVID-19 screenings. Your provider can help you determine if testing is necessary or provide guidance on necessary isolation recommendations. Telemedicine can provide common health care, so wellness visits and advice about non-emergency illnesses. Your provider can prescribe medications using telemedicine and offer services such as nutrition or mental health counseling. Learning objectives. At the conclusion of this activity, participants will be able to identify the types of care available using telemedicine, recognize the benefits of telemedicine for patients, recall the benefits of telemedicine for providers, and define telemedicine. Please stop the presentation here and take the pretest in the link below to test your knowledge on telemedicine. Please return when finished so we can continue our discussion. Welcome back. Let's discuss some benefits of telemedicine. For you, the patient. Telemedicine allows you to talk to your healthcare provider live over video. You can send messages to your doctor by email or an instant chat messenger. Telemedicine allows for remote monitoring. It will also save on costs of travel or transportation needs. Telemedicine will also reduce your wait time and number of visits you need to be seen in the doctor's office. Besides saving on transportation costs, research suggests that telemedicine may decrease your time in the hospital, which will also decrease costs. Improved access to care. Telemedicine makes it easier for certain conditions to access health care, such as people with disabilities or the elderly population. Preventative care. Telemedicine helps the population have access to preventative care, which ultimately improves long-term health. Telemedicine is also convenient. It allows for patients to access care from your home, right from the comfort of your couch. This also means less time off of work or less time finding someone to watch the kids while you run to the doctor's office. As we discussed before, telemedicine will also slow the spread of infection. If you go to the doctor's office, you will be around other people that are sick. Telemedicine eliminates the risk of getting an infection from the doctor's office. So now we will discuss the benefits to the providers. It reduces expenses. Providers may have fewer overhead costs if they provide telemedicine. This is because office staff may be reduced by using telemedicine. Additional revenue. Doctors may actually be able to see more patients using telemedicine because of convenience to the patient, which may increase the revenue stream to the provider. Not only is less contact with other patients safer for us, but it is also for the provider. The doctor will also have less exposure to illness or infection. Patient satisfaction. Telemedicine actually does increase the satisfaction rate of patients. Again, patients have less worry about transportation or time off of work. There is no waiting in the waiting room or then further waiting in the exam room. This makes patients happier with care. Finally, privacy and security. Telemedicine has many benefits for us, the patients and the providers. But as the patient, it is okay to ask, is the visit secure? To start, we need to understand the Health Insurance Portability and Accountability Act. This is known as HIPAA. One of the most important things that HIPAA does is protect the private information of the patient. Your provider will have to use a telemedicine solution to remain HIPAA compliant. But it is okay to still ask this question. Is the telemedicine portal secure? Is it encrypted? Is the video saved? Also do your part. The healthcare provider has a responsibility to protect your privacy, but you have to do your part as well. Follow the directions provided by your doctor's office when using the application. Secure your device with passwords. Make sure you are doing your video in privacy. Telemedicine makes it convenient to see your provider from everywhere, but it is also our responsibility to maintain our own privacy. Telemedicine is a great solution, but as the patient, we need to be comfortable with the visit as well. This brings us to the end of the presentation. I want to thank you for listening. Please see the links below to take the post-test and check out the handout. I am Nicole Getz from the Indiana State University School of Nursing.